We're headed into study of the constituents of the blood. We'll call it hematological pathologies that we're looking at. And I don't know, sometime in the recent past, I saw this picture and I thought, here are the constituents of the blood. I showed it to my colleague, Dr. Cosby, and she saw a dolphin going airborne and spouting. I see the constituents of the blood. So here we go. This is a study of too much of something or too little of something. This is the pathology of injury and illness. And if there's too much of a certain kind of cell or not enough, function gets altered, and perhaps it's a result of a disease process or is causes a disease process. So we're in the process of studying penias and cytoses. Penia is too little, cytosis is too much. And signs and symptoms that are generalized to the various constituent parts of the blood that can be disease, but the umbrella of signs and symptoms are lymphedema, where excessive lymphatic buildup occurs. We've talked about this in dependent edema previously, but these edematous swellings can be in the cranium. They can be inflammatory in nature. We've talked about peripheral edema, and also we've talked about pulmonary edema associated with congestive heart failure. There's a great volume of blood in the tissues. This can lead to infarctions. You know the general category of pathology where tissues are being deprived of oxygen, and so they die. Avascular necrosis. There can be associated thrombus development or embolus. I think you've got this down. A thrombus is a blood clot. An embolus is a blood clot on the move, or a thrombus on the move. And you can appreciate that if there are too many red blood cells, too many white blood cells, too many thrombocytes, those collect, and where there is narrowing of the tubing system of the tubing of the vascular system, there are places for these cells to build up, stick, occlude circulation, and then break loose and go into the pulmonary circulation or the general circulation. And then another symptom is, I should say sign, is shock. And this results in hypotension, and the causes of those are not enough volume, could be cardiac related where blood's not getting circulated. It could be obstructive like in a thrombus or an embolus. It could be septic in that there's disease that's circulating in the blood, septicemia, that can lead to shock, and then neurogenic shock where the nervous system is inappropriately behaving, the autonomic nervous systems primarily. And then we go to what you've been thought about this. We might have mentioned it in class in passing already, and that is where there's a reduced oxygen carrying capacity in the blood because there's not enough red blood cells, and that's anemia. The definition of the blood, the red blood cells are not carrying enough oxygen due to decreased quantity or quality of red blood cells. A measure of how many red blood cells are this is solid component of the blood, is a measure of the hematocrit, and you see if men's hematocrit gets below 41% or women below 37%, this person is anemic, they're going to be tired, and their immune system is vulnerable. I just find this very, very practical. Where the rubber meets the road, be alert. If your roomie or a buddy or one of your clients says, I'm just eating ice, I'm crunching ice all the time. Maybe they won't confess it, but you notice it. They're never anywhere without a cup of ice, and they're pounding the ice. This is a red flag for you that they're experiencing anemia. The other symptom is that I would call craving ice or always eating ice is a sign, something that you pick up. If they say it to you, it's a symptom. But also burning thighs, the inner portion of the thighs, they'll say, I can't seem to get relief from this burning. Different types of anemia. I think at this point I'm just going to let you enjoy this on the PowerPoint posted on eClass. Rather than reading to you, I just want to point out that the chronic disease or inflammation category leading to anemia is rheumatoid arthritis, systemic lupus erythematosus. I'm not emphasizing that over these other etiological factors or types of anemia. But you consume that, take this in. There's a nutritional component, not enough nutrients, or iron, and infectious disease. So please read through this and pick up on it so you're not surprised in your reading or in actual clinical practice. Now, the causes of anemia, obviously, these are three categories. The first, I think, comes to you right away. Why don't we have enough red blood cells? Erythrocytopenia. Why do we not have enough? Well, it could be from the vascular system's been opened through a trauma and the person is hemorrhaging large amounts of blood, right? And so that's one way. Excessive menstruation. Now I want you to know, this is kind of glossary related. Menorrhagia and metorrhagia are two different expressions of vaginal blood. One is the normal menstrual flow, and the other is bleeding that's not related to menses. Okay, it could be indicative of an underlying condition where it might be neoplastic in that the tissues are not healing, or it might be thrombocytopenia where there's not coagulation of blood or clotting of blood, and there's excessive bleeding. So menorrhagia is related to is menstrual bleeding. Metorrhagia is non-related to menses. And then excessive destruction of erythrocytes due to autoimmune disease, sickle cell, or thalassemia. We'll talk about thalassemia in class. I think you have a sense of sickle cell, and we'll allude to that. And then decreased production of erythrocytes. You know that the blood constituents are formed in the marrow of the blood. If there's neoplastic disease in the marrow, we may not have enough red blood cells ever manufactured. And we'll follow up on that. Bone marrow failure is part of that. That leads to leukemia, aplasia, and multiple myeloma. It seemed like I wanted to say one more thing to you there about that. Marrow-related disease process. It's spoken of as myeloma. So that'll come here in just a little bit. And then we really head into the disease, the study of disease, leukemia, malignant neoplasms of blood-forming cells, and those could be lymphocytic or myelogenous. Myelogenous, again, formed in the bone marrow, myelogenous, or lymphocytic is formed in the lymphatic system. What is the disease of leukemia? It is dysplastic cells. There's dysplasia going on. Those cells get changed and their function is altered, and then the cascade of cancer that we've talked about before can metastasize to other systems, and there's actually myelogenous cells in a distant site, a secondary tumor. And then hyperplasia, overproduction of white blood cells. This is characteristic of leukemia. Overproduction of white blood cells, okay, leads to leukocytosis. And in the process of too many white blood cells, the red blood cells get crowded out. So you can imagine that a person manifests deprivation of oxygen because their white blood cells just proliferate so greatly. Here's a list. I know that you don't want to just memorize lists, but all of this begins to make sense when you think that white blood cells are predominating. I think a couple of the big indicators are that there's subcutaneous bleeds known as petechiae or purpura. The person bleeds readily and tend to bruise. They have joint pain and they have night sweats. They're anemic and they tend to bleed from the gums. We shift gears now. We push upon. We've got a new paragraph here, and we go to diseases of the lymphatic system. Now we're going to study lymphomas in way depth coming up. It's way important you know that because you know we've talked about the sentinel node and the drainage of cancer cells through metastasis into the lymphatic system. But lymphomas tend to be diseases of young adults. And I want us to discriminate between Hodgkin's lymphoma and non-Hodgkin's lymphoma. Here's the very simple difference between the two. And when I say simple, this is a complex disease. That's not what I mean. But just grasping what's the difference between Hodgkin's and non-Hodgkin's. In Hodgkin's, there's a very symmetrical spread or metastasis of the disease. And so the disease will be bilateral and it will metastasize from superior to inferior. And so what happens is the disease starts and then spreads symmetrically. Yeah, so it's quite predictable in the manifestations. It's just the reason I include this histological slide is here's the cell that is dysplastic. Yeah, called the Reed-Sternberg cell. And the signs and symptoms, obviously enlarged lymph nodes, night sweats, itching, known as pruritus, we've talked about that, weight loss and fatigue, and alcohol produces bone pain. We ingest alcohol. Here's a little pup. He's got cancer. What would you expect? Would you expect that he'd have something similar on the other side of his neck? It's bilateral, and it moves from superior to inferior. And then just in contrast, you can see that this random pattern of non-Hodgkin's lymphoma, if you trace here, it's not symmetrical. It's get a spot on one side and not on the other, and this may be the first manifestation of non-Hodgkin's lymphoma in this PET scan. And then the disease that is just, I've provided these pictures to really zing it home. Multiple myeloma is a neoplastic disease of the marrow, and this causes osteolysis. Now the suffix lysis means breaking down of the skeleton, and so this x-ray shows that these tibiae, this particular tibia, has become way weakened as a result of cancer of the bone marrow. And very, very painful. Bone pain is very painful. We'll pick you up on another video to complete this.